what governments know about each of us, what they do with that data, and how they make decisions based on it is supposed to be available to citizens. It's a fundamental principle of democratic accountability. But as a recent series in the Globe and Mail demonstrated, that's not quite how it all works. The series is called Secret Canada, and it raises many questions about how freedom of information works in this country, or more likely, how it doesn't work. Okay, let's get into this, and welcome in County Kilkenny, Ireland, Brooks Fallis. He's a critical care and internal medicine physician. And here in our studio, Patricia Kasim, Information and Privacy Commissioner for the province of Ontario, and the investigative reporters behind the Globe and Mail series Secret Canada. There's Robyn and Tom Cardozo. And it's great to have you three here in our studio. Congratulations on the series. I read every word of it. It's terrific. And Dr. Fallis, great to have you overseas with us as well. We should just tell everybody you're Canadian, but you're overseas right now doing what one does. And I'm going to start with you because your personal circumstances required you at some point to make a request for access to information. And I wonder if you could just sort of briefly tell us how that all went.
Sure. So I was appointed to be the interim medical director of critical care at the William Osler healthcare system just before the onset of the pandemic, just that February, right before when we started hearing rumors. I became the medical director then. So I was the medical director for the first year of the pandemic. Lots of changes happening in the hospital, lots of big decisions to be made as we went along. And during the first wave, I guess I was very aligned with the hospital. They were putting me forward for interviews with the media and involved in a lot of the big decision making. When the second wave really took off, I felt that the government had shifted away from best scientific practices, and that the response was becoming politicized, and that was going to cost lives and more hospital admissions, more deaths, et cetera. So I started speaking out about that first, kind of with some media interviews, some op-eds, and social media. The hospital wasn't too happy about that, but we established a sort of agreement that they agreed with what I was trying to say, but they felt that it could create risk for the hospital. And risk was in the form of the government being upset and perhaps that impacting future negotiations or future funding or things like that. Then I was offered a contract renewal in December, but then rather suddenly in January 2021, I was terminated from the position about 10 days before the renewal would have kicked in. I was pretty surprised by this because I thought we were on a good footing together, me and the hospital. And I also thought the things that I was saying publicly were important, that people would be aware of all of this information, of what was really going on in the front lines. So I had an exit interview, and they gave me clear information that they said, well, basically the government and the Ministry of Health had been complaining about what I was saying publicly, and they felt I was too great a risk to the hospital. So they felt they should move on from me as a leader in the hospital. They were quite clear to say that they were happy with my leadership and that they were happy with my medical work. And if it wasn't for this social media advocacy and media appearances, they would have kept me on and felt I still had a leadership future with the hospital.
So what did you want to find out by using access to information?
Well, once I went public with what had happened, they then sort of redacted everything and said, oh, no, we misspoke. That wasn't what really happened. We misspoke. So I used FOI to try to figure out what really happened and to get sort of concrete information that would go beyond what they had told me previously, and to try and link this all together. So I submitted freedom of information requests to cabinets and the Premier's office, to William Osler Health System, as well as the Ministry of Health.
And what'd you find out?
Well, from Osler, there was tons of information that aligned with what they had told me previously. There were emails talking about how they had been receiving complaint phone calls and emails. There was documentation of, when I wrote an op-ed that was critical of the government, they had a whole rollout plan to notify the Premier's office, the Mayor's office, their local contacts at the Ministry of Health, and to make sure everybody was aware that this thing was coming out, to allow them to prepare for that. And the Ministry of Health, actually, I gave up on that one because I was quoted 3 searches at $1,500 per search. So I felt I couldn't afford to pay that. So I scaled that one back significantly. And then the Premier's office, there was some typed out versions of interviews that I'd done in their sort of media coverage that they email out.
So what was your takeaway in terms of the usefulness of going through the Freedom of Information process?
So submitting an application, extremely easy, extremely affordable, and then highly varied responses from different places. So the response from the hospital, they wanted 9 months to do their original search. So I appealed that. And working through the Privacy Commissioner's office, it was through a mediator, it was brought down to about 5 months. But then the information I got was there was huge amounts of redactions that were really hard to figure out what was even in there, because it's totally, blacked out on the documents. So I appealed that, and when I appealed the redactions, a lot of the redactions were then revealed to me, and then I pushed even further in a sort of phone call negotiation that the mediator set up between me and Osler, and again they provided. Released more of the redactions and discovered new documents that hadn't been released or hadn't been produced in the original search, despite the fact that those documents would have been on many people's email inboxes from the original search.
Okay, let me get Robyn Doolittle in here now. That's one person's story dealing with the Freedom of Information system we have in Canada, or in particular in the province of Ontario this time. How typical is that?
I think it's extremely typical. And I think the reason we were so interested in Brooks's story is it is a perfect case study for what happens. He had to file 3 appeals to get the information that he was looking for. And how many people bother going through all of those hurdles? How many people would see redactions on a document, not really know what they're looking at, and trust the public institution that they're following the law? So Tom and I spent 20 months investigating Canada's broken Freedom of Information system.
You say broken. You're convinced it's broken.
I mean, it's worse than broken, I think, in many ways. And what is so crucial is these laws exist for a reason. This is foundation of democracy stuff. And you see someone here, just a regular person who was trying to understand why they lost their job from a public institution. And it took, I think this was 2 years, this process that was going on. And just countless amount of resources and time spent in it. I think Brooks told us, this was almost like a part-time job for him, in addition to being a doctor and saving lives.
Tom, from my understanding of things, the Freedom of Information system is something that journalists mostly use and are not bad at figuring out how to use it. Brooks is he's a civilian, if I can put it that way, as opposed to a journalist. Do journalists have an easier time getting information than civilians?
Well, first, I think I challenge you on the idea that journalists are the primary users. They're actually, by far, they're a small minority of the system. Most users of the system are normal people, civilians, like Brooks, and their businesses. So it's people that are looking to learn more about their government, more about, the example I keep using is, trash pickup for the city that someone lives in. Like, why isn't my trash being picked up as frequently? Why am I paying more in this obscure tax? It's people asking questions like that, or people like Brooks trying to understand what happened in this complex process, happening 12 layers up from me. So first of all, I think, certainly there's a lot of people who are using the system who are not the people that you and I think of. But when it comes to journalists, I think we all know that there are fundamental problems with the Freedom of Information system, or systems in Canada, because we have one for every jurisdiction, province, territory, and the feds. We all know that there are all of these hoops that you have to jump through. There's so many issues that you encounter on a daily basis trying to just learn about a briefing note, like a letter written to a minister explaining a topic. We sometimes get involved in fights that take years. Robyn and I have had FOIs that have taken 3, 4, 5 years to get answers on. And of course, by the time you get those documents, it's not super interesting or useful anymore. I'm still waiting on stuff from COVID.
From COVID, so from 3 years ago.
Oh, yeah.
Okay. Well, we have the Information and Privacy Commissioner here, part of whose job is to, I guess, ensure that Ontarians get access to the information that is of relevance to them. How well do you think the system works?
I think the system can certainly use drastic improvements all around, and we can get into some of those solutions later. But I think Dr. Fallis' story is a really good example of why this really matters, why it matters to Ontarians, why it matters to, to them individually, their communities. And, as Robyn says, and I agree, it's the fundamental underpinning of a healthy democracy. So we can't afford for the system not to work. It has to, be fit for purpose. It has to be modernized. And it has to allow, whatever the outcome, it has to allow people like Dr. Fallis the right to the opportunity to exercise their right to access to information, and institutions a fair opportunity to respond when there are, legitimate exemptions that apply and that the law has recognized and are important to uphold as well. So, in all, I think it is fundamentally important, and I want to congratulate Robyn and Tom for really bringing light to this issue. I mean, as information and privacy commissioners, we often say that transparency, unfortunately, isn't as sexy as its privacy sibling, but this really does expose how important it is and how just absolutely fundamental that we get it right.
Brooks, let me just understand from you a little more. Why was it important to you to make that freedom of information request and get the information that you were after? What was so key about that information that you wanted to know?
So, two things. I think the first is just for myself wanting to understand what was happening in the background and understand the truth, particularly when the hospital had flipped on what they told me. I put a lot into that first year of the pandemic. I really, tried to do as much as I possibly could to impact not only within the ICU and how we were treating patients, but to try to impact how we responded, and knowing that the quality of our response was going to impact the number of people who died. So to me, to put that much into it and then to lose my job when they said, you did a great job, but we just don't like the way this fits with our image, essentially. To lose my job like that was pretty upsetting to me. So to get to the bottom of that information was important for me. But secondly, we're talking about democracy and how things run. A hospital needs to be able to stand on its own in a public healthcare system, and leaders within the hospital, doctors, nurses, other leaders need to be able to speak publicly about issues that they see in the healthcare system without fear of some sort of, potential government retribution, whether that's in the form of funding or people losing their position. And when I went public with this, I had hoped it would motivate other people to speak publicly, but I wonder in the long run if it'll end up backfiring, that people will say, oh, this kind of thing could happen to me, so I should probably just keep quiet. And I think the FOI system is a key piece of being able to hold people accountable by getting a hold of that information so things can't happen in secret.
Robyn, let me follow up with you on your experience. Does Brooks's case actually lead people to think, oh, okay, there's a system available to me, I'm going to use it and try and get information? Or based on your experience, does it have the opposite view, which is it costs too much money, it takes way too long, to hell with it, I'm not going to bother?
I think the reality is that most people have no idea what freedom of information is. And this has been a huge challenge for us that I think that we're doing a pretty good job of, but that's something that we've always been conscious of when doing this reporting. Journalists are constantly moaning about freedom of information. If you follow any journalists on Twitter, you're seeing them posting pictures of blacked out paper. What we wanted to do was really make clear to people that this is impacting everyone, right? This is about citizens paying taxes, electing leaders, and getting to know how their money's being spent, how their institutions are being run, how their political leaders are governing. We own that information as the people. And so making that argument and really driving that home for people is important. I think when people hear a story like what happened with Brooks, they go, that's not right. That's ridiculous. And I think that that's something else that we've really tried to drive home is when a hospital like William Osler's has to have 3 appeals to release the information that Brooks asked for, I think there are real questions around, are you breaking the law? These FOI laws are laws. And the law is very clear that information is supposed to be public except in the very specific exemptions that the acts lay out, which are like, this is a threat to national security. This is a citizen's private information. I think what was really interesting for me going through the documents that Brooks got in his various iterations of release, there is absolutely no reason that I can see why some of this information would have been withheld, except for the fact that it was embarrassing for the hospital.
So, Tom, nothing to do with national security, nothing to do with procuring drugs for, to fight COVID. This was strictly a case of the government not wanting to be embarrassed or the hospital not wanting to be embarrassed?
I mean, that's Robyn and I have seen this so much. We talk about, the mythical embarrassment redaction now, and we're talking about the redactions that we're seeing from, ourselves, normal people who are sending us their own FOI battles. Governments really don't like to be embarrassed, and public bodies really don't like to be embarrassed. But the truth is that there's nothing in any of these laws that says we don't have to give you information if it could be embarrassing to us. So this is something that we're seeing all the time. I talk to colleagues constantly who have won an appeal, gotten a paragraph in a document unredacted, and it's completely milquetoast, nothing of consequence. But someone on the other end was being either overzealous, or they were undertrained, or they were being intentionally told, let's not give them that because the risk could outweigh the benefit.
Well, let me pick up on that with Patricia. It's not completely unreasonable for a bureaucrat to look at an FOI, Freedom of Information request, and say, I can imagine that my minister will not want that out, and therefore I'm going to deny this request or put some sand in the gears, that kind of thing. How much of that's going on, as opposed to politicians actually putting their thumb on the scale against this?
Well, I want to say first that it's important not to throw FOI coordinators under the bus. A lot of these are very dedicated public servants. They're in these jobs because they care about transparency, and they're really just trying to do and fulfill their responsibilities and do the best they can with the limited resources. So I really want to put that out there. The other thing is many of them are dealing with chronically under-resourced offices. Of course, resources, is a matter of priority. Budgets are constrained, but in the end, it's how you allocate the money. And certainly, this has been a chronic issue provincially, and I've seen it in the years I worked federally as well. The other thing is, there's often pressure from above not to release the information or to maybe delay the information using the process.
How does that happen?
Asking for extensions to delays, asking for extensions to submissions. Now, sometimes they're legitimate.
I guess what I mean is, no cabinet minister is going to come to an FOI official and say, "Could you please gum this up?"
No, I'm saying it comes from both parties. Sometimes it's the institutions that ask for delays. Sometimes it's the appellant or the individual who is not necessarily the most prompt in helping us move forward appeals, or in helping the institution by narrowing down their request or being more specific. Sometimes, unfortunately, they're a very small number, but sometimes there are frivolous and vexatious requests that get made that really do gum up the system. So there's a lot of factors that contribute to the delays. There's poor information management practices to begin with. I mean, a lot of times institutions are scrambling just to find the records that are responsive, and that could be much easier if there were good discipline hygiene practices around information.
Okay, you won't be shocked to hear, though, that I'm going for the most nefarious example here. So, Robyn, let's see. How often would it be the case that, for example, a chief of staff to a cabinet minister, in order to spare his or her minister's embarrassment, would go to the FOI official involved and say, let's just slow walk this a bit, shall we?
Well, I can say that we interviewed well over 200 people who regularly work with FOI, work in the system. They're public officials, they're politicians, they're FOI coordinators, they're high-frequency users. And we encountered multiple individuals who work in the system who said exactly that happened, that the minister's office or someone in an equivalent role said, why don't we just delay this? One example, is to wait till after an election comes out. I would say it is incredibly common that public institutions will deny or withhold some information because it's inconvenient for some reason. And this is across the country. And I think the other thing is there are absolutely no consequences for doing that. So
other than you've broken the law.
But no one cares. I mean, one person who, previously, I hope people care now, but we had a story in the paper recently where someone had an amazing quote that was like, you are more likely to face consequences for a parking ticket in this country than withholding public information that is of huge importance. So when you talk about, an individual who's looking at something and should I release this, and it might cause the minister's office to be upset, what the FOI coordinators and what the staff are telling us is, so if you're in their shoes, are you going to, just for workplace politics reasons, that you have to work at this place, you have to work with these people, you want to rise in this organization, are you going to release something that might upset your boss or your boss's boss when there are absolutely no consequences for not doing it? What's going to happen? Your worst case scenario, you withhold something that you shouldn't, you send it to the appellant or to the requester, maybe they file an appeal. The vast, vast, vast majority of requests do not get appealed. People, again, don't really even understand this system. So then you file an appeal. You look at, the majority of this country, there's huge backlogs at the appeals commissions. We have a story in the paper today about Nova Scotia. It's a 3 to 4 year wait in Nova Scotia to get an appeal. And if you win that appeal, something like 8 or 9 of the jurisdictions in Canada, the appeals commissioner can say, you must release this document. But in other parts of this country, they don't even have that power. So you win an appeal, maybe the record gets released to you. That's it. There's no further consequence for anybody. So what we hear time and time again from people who work in the system is that there is a real risk aversion within the public service, and there are no incentives to release something that might upset the people in their aura. And that's what we need to shift this conversation. People need to be reassessing that risk calculation. They should be worried about not releasing what the law requires them, because there will be consequences on the other end of that.
Do we need, Tom, amendments to the law which say, you have X amount of time to get this done. If you don't, you're fired, or you're sanctioned, or you're somehow suspended, or something.
Or the document's released automatically.
Or that, yeah.
Yeah, I tend to lean less towards the punish the individuals, because I think, like Patricia was saying, there's a lot of people who are, on the front lines doing this work, trying to do it. I think the problem ends up becoming a lot more serious when you go up a few layers and you get into the management or the senior management. I mean, to the point about ministers' offices, we know for a fact that ministers' offices all across the country regularly get briefings on the FOIs that are coming in the door. Why would they need to know that? They're not the ones responding to the requests, right? So there's immediately room there for issues or communications management to occur, which is where all this stuff starts to break down. I think a much more interesting idea is something like what Robyn talked about. These documents are disclosed as a matter of practice if you don't respond within a certain time, or perhaps those managers, their bonuses are tied to FOI performance in some way. Give them an incentive to do the right thing.
Well, okay, Brooks, let me get you back in here. I understand why you obviously cared a great deal about the determination of your particular case. But let's face it, at some point in our lives, we all use schools, we all use the healthcare system. There's a great deal of interest in those issues. We don't all file FOI requests. In fact, I suspect precious few of us at the end of the day actually do these things. So give us your view on why you think the public ought to be invested in this issue.
Well, I think people need to realize that a good FOI system isn't just about an individual like me deciding to apply and see what information you can dig up. It's about people, journalists, and people researching specific topics, digging deep and putting pressure on organizations to be transparent. And if you don't have this form of accountability, if you aren't transparent and a way of finding out that information, then transparency is just a word that we toss around. But this is a way of enforcing transparency in public organizations and government. So if it's weak, then your ability to sort of back up the word transparency becomes impossible because you can't get the information. And one of the things to follow on one of the other comments is that, in Robyn and Tom's article about my situation, William Osler said to them, they follow the FOI laws and they followed along and followed the system. So the fact that despite demonstrating that multiple appeals led to release of almost all the redacted information and new documents that weren't even found in the first place, they don't feel they did anything wrong. That's problematic to me because it means at the organizational level, they think that approach is just fine. So I think there needs to be some accountability and some teeth to the legislation that says that no, what you did there was not fine. All that information should have been released upfront in a timely manner.
Well, that takes me to Patricia. How do we get a system in place that has consequences and that is more accountable?
So in Ontario, we're fortunate in being one of those jurisdictions where the Information Privacy Commissioner's Office, like mine, does have order-making powers.
Do you use them?
Oh yes, we do. In cases that do go to adjudication, which in fact is a very small minority of cases that actually go full-on adjudication. The vast majority get resolved in early resolution and mediation, upstream, so to speak. So I think legislative change, particularly in those jurisdictions that don't have order-making powers, is a really important point. And in jurisdictions like Ontario, I think there's room for provisions and amendments that can tighten up the process. I think there's a lot of opportunity to tighten up timelines, tighten up consequences, process consequences along the way for both parties that try to delay or gum up the system. So I think that legislation is important. I really want to stress the importance of culture. And that is so important to
As in
really
establishing a culture of openness?
A culture of openness by default. In a recent podcast that I had on Info Matters, I had as a guest Alex Himmelfarb, who's a former clerk serving 3 prime ministers in the federal government. And he reflected back on his experience in government and said, sure, we made mistakes. He said, but in the end, government decisions are messy, and sometimes when you expose them, you take a hit for it, but you take a much harder hit if you try to hide it. And I think it's just changing that mindset to have the moral courage to be open by default, upfront. And in the end, it would be, I think, a much better risk calculus, as Robyn said. And so I think culture, in addition to law, and there are many other things, but I just want to throw in technology. I mean, there's so many technological innovations, even AI tools that can help accelerate the process that was built for an analog world and a paper-based system to a digital era where individuals expect instantaneous access to this information, especially in an age, and I want to make this point, of misinformation, fueled by mass public access to generative AI tools, where more than ever individuals need access to legitimate, truthful sources of information, that I think it's incumbent on governments to put that information out there.
Well, let me ask you too about this, because I remember, as a Queen's Park reporter, probably before both of you were born, covering the actual creation of the first Freedom of Information law in the province of Ontario. David Peterson's government brought it in the mid-1980s. And there was a lot of excitement in the air about how forward-looking and advanced the province of Ontario was, because we had this new law that I don't think any other province had at that time. Okay, that was then. How do we get back to that?
There's the excitement about the law, and then there's the forcing people to follow the law. And I think, one thing that was really interesting for us, we sent out test FOIs to test precedents. So when an appeals commission makes a decision on an issue, theoretically, that is supposed to say, okay, this issue, we've looked at this issue, this is our stance on it. The courts weigh in with precedents as well. These are all the things that are adding to our understanding of the law. And when I talk about institutions breaking the law, prime example, and I spoke with one of Patricia's predecessors, Brian Beamish, who was saying the best example of this is contracts. Contracts are undisputedly public documents. The courts have upheld this. Appeals commissions across the country have upheld this. Governments should just be posting them online as a matter of course, which is what happens in other countries like the United States.
Unless you're building an LRT or a spa down at the waterfront, then it's all secret.
But it should immediately go online. And we yet filed very basic requests for contracts. I asked the city of Windsor for its garbage contract and the city of Halifax for its garbage contract, and both were denied. The City of Windsor just outright denied it. The City of Halifax said we would like to deny, or we would like to release it, but that they notified the contractor, and the contractor objected to it. And so now it's in the 4-year appeals backlog. There is no reason to have notified the garbage collection company. It is a matter of undisputed law that contracts are public. Sometimes things like, let's say I was asking for an institution's, this is the example that's always given, an institution's contract with the Coca-Cola company for vending in the office. I get to know the amount of money that the government is spending on this contract. I don't get to know Coca-Cola's recipe. That's the part that can be redacted, but the total amount isn't, and yet it's just done across the board. So this is an example of there is a law, and it's just not being followed, and government does not care. They say, what are you going to do about it? That's where we're at right now, and that's what we're trying to change.
Well, is there anybody, Tom, in this country, either provincially or in other jurisdictions around the world, that is doing it better than us and that we should learn from?
Well, I think there's a few interesting examples even in Canada. There's an example that really captures my interest right now is the province of Newfoundland and Labrador. They had a huge spat about FOI in 2012. The government passed a law, Bill 29, that walked back some of the provisions in their law, and it became a political time bomb, basically. It was, people would talk about it in the street, about how this law was an example of government mismanagement and of over-secrecy, and that they didn't trust the public. And it ultimately, in part, probably cost them their government, the Progressive Conservatives at the time. But the last thing they did, one of the last laws that they passed before they lost their election in 2015, was they passed a new law that was wholly rewritten by a panel, an independent civilian panel. And now it's, I think, probably the strongest law in the country. There are no fees in most cases. The percentage of people, before about 35-40% of normal citizens were filing 35% of the system was normal people. Now it's 60%. The number of FOIs has grown by about 275%. So they've really drastically overhauled the system. Almost all actually every single appeal now is completed within 13 weeks. As a matter of course, they never take longer than that. Most FOIs, 80-something, 90%, are released within 20 business days.
So Ontario government, take note.
There's a lot to learn from other provinces.
Robyn, you and Tom have worked on this Secret Canada thing. You've now got this website, this project you've done on behalf of the Globe and Mail. Where do you want it to go?
You mentioned the website, secretcanada.com. When we sat down and were talking about trying to do this investigation, one thing that we knew we had to do was we couldn't just be two whiny journalists complaining about broken access information. Everyone's sick of journalists complaining about FOI. We knew we wanted to at least present some sort of a solution. And that was, at least in this one specific area, that we could tackle. One of the big flaws with the Canadian system is that no one has any idea what other people are getting through FOI. In other countries, it is a matter of course that, in the United States, when you asked where is a good example, the United States. The United States has a completely different relationship with information and transparency than Canada does. Canada is very much like, no, just trust us. This is fine. Immediately stop. The United States, this is a matter of freedom. The US is just constantly proactively disclosing information. What we did was we sent FOIs to more than 450 institutions in Canada, from cities and core governments, hospitals, school boards, universities, crown corporations, to collect all of their FOI summaries that they received in the last year and a half, and made them searchable. So any Canadian can go on secretcanada.com and look up what's already been released, and it will help them save money. It'll streamline the process. We also have how-to guides and resources on the website to teach people how to do this. We have letter generators that it'll make a shortcut to how to request. And then we have a news section where this is, the dream is we're going to start naming names and calling people out. If you are withholding information improperly, we're going to write about it. And one thing really quickly, because I sense this is winding down, that I want to bring up, that was another example with what Brooks dealt with. The hospital hired a Bay Street law firm to argue against him. And Brooks filed an FOI with the hospital to see how much the hospital had spent on this FOI consultation work in a year.
Did you find out?
Yes, it was. Well, Brooks, do you want to say it's your story?
It was 13 months, and it was just over $130,000.
Holy smokes.
And
that money, I'm sure, wouldn't have done any good at all being spent on patient care.
Precisely.
And this is a really common, we wrote about a developer who suddenly had his building permits stopped being approved. And there was the same thing of, he spent all of this money and got back 3,500 pages of redacted information or no information. So lots to be broken, lots to be written about.
I know you want another word, but the control room's giving me the rap sign.
I'm sorry.
So we got to have everybody back. We'll have to do further follow-ups on secretcanada.com and see if you folks have made any progress with this project of yours. Well done. Can I thank Brooks Fallis for being there for us all the way over in Ireland. Really appreciate your time tonight here on TVO. Patricia Cosine, the Information and Privacy Commissioner for the province of Ontario, and the dynamic duo from the Globe and Mail, Robyn Doolittle and Tom Cardozo. SecretCanada.com is their project. Thanks so much, everybody. Great to have you here.
Thanks, Steve.
Thanks.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.